Okay, so first of all, namaste everybody. So this is Yogesh, and I'm going to help you in the yoga anatomy. Okay, so I hope my audio and this sound is audible for everybody, right? Thank you. Right, so when I say guys anatomy, so here I'm not gonna see when I talk about the anatomy, most of the time it's happened that the student they think that they need to be they need to learn lots of technical terms in order to understand anatomy, but not in reality, because we are not going to be a doctor. We are just going to understand that what is the importance of anatomy and how we can basically apply the anatomy in our daily practice, especially on the mat. So when we are learning anatomy on the mat, so it's not necessary that we learn lots of technical terms. As much as possible, we will make our class more easy and more layman. Just make it more easy for this. So because we are learning yoga anatomy, and it's more about applied. Whatever you learn, you try to apply. So in these upcoming days, whatever you learn in my class, you try to apply on the mat and see does it work for you or not. So first I would like to tell you that why we need to learn anatomy in yoga. This is one of the questions which I get often during my classes, that what is the purpose? Why we are learning anatomy in yoga? And my simple answer is, we don't, as I told you before, that need to learn lots of technical terms, but when you know the anatomy of your body, you can listen your body. Like just for example, I know about my shoulder joint. So when I move my shoulder joint, and if I feel pain and I feel discomfort, I feel block, I can feel what exactly happening inside, because I can listen what really my body wants to tell me. So it's more about that, is the listening, the inner will, the power and the voice from inside. Because lots of things we have, like just for another example, we have different muscles in the human body. Some muscles are very deep, some muscles are outside means superficialis. So those muscles which are the deep, if I want to work on those muscles, I don't need to just do lots of movement, I also need a little bit awareness. I need to visualize that muscles. That's how the body works. So yoga anatomy is about create awareness as well. So if you know how your shoulder joint look, what is we have in the shoulder joint, if you know what we have in the knee joint or hip joint, that will help us to understand that how I'm going to rotate it. And this is very important. So that's the purpose of anatomy. And also that when we are learning yoga anatomy, see, nowadays we have everything on the mat. We have bolster, we have brakes, we have a strap, we have many different things. But what is lacking in our practice is the knowledge of this, the knowledge of the body. And that's what the yoga is a science. Yoga is not just sitting in in the cross-leg position with a grumpy face. That's not basically the yoga. Because most of the time what we assume that yoga means doing forward bend and backward bend. But in reality, that's not what yoga is. So basically with the help of anatomy, we try to just get a proper idea of yoga. What is yoga? Now let I go a little bit more deep. Why we need to learn anatomy? So this is, I have just given a superficialist view that we need to build awareness. We need to...
Why to learn?
Sorry?
Sorry, I'll put my...
Yeah, you can just mute your mic. Thank you very much. And if you have any question after, we have a 1 hour class, so 45 minutes I will just make a lecture, right? And then after 15 minutes we can have a normal question answer, right? And feel free, I would love to take the questions, because in the end, you have to understand the main concept, right? So let I go a little bit deep, that why we need to learn yoga anatomy. and why yoga anatomy is very important. See guys, our main purpose, our main aim to do yoga, asanas, is not to get more flexibility. Our main aim to get doing asanas and doing different posture to improve three basic essential forces. The first, blood. So we are going to improve the flow of blood. Second, the flow of information. And third, the flow of prana. This is our main aim to do, learn anatomy basically. So flow of blood with the help of blood pipes, we call arteries and veins. Flow of information with the help of nerves. And the flow of prana with the help of nadis. So most of the time, like when we are doing asanas and we are extremely over tense, it's happened like, you might feel like when you're doing asana, you are like, your face is like squeezing and you're feeling that, pain in your body, and you feel like totally it's very hard, right? So what mainly we need to understand in this point, that with the help of yoga anatomy we will improve the flow of blood, flow of information and flow of prana. But how? When we know how much to stretch. Because the moment you try to contract your body a lot, so sometimes because we have learned that yoga means no pain, no gain. That's, I think we have general assumptions. That if I'm doing yoga, I need to feel more pain, I need to stretch my hamstring more, I need to contract my quad a lot. That's what we have learned in the basic. But these things will restrict these three basic essential forces of the body: blood, information and prana. So with the help of yoga anatomy, because see, there is no like a idea that how much you need to stretch and how much you need to burn. That's based on individual structure, individual person, because we all have our different anatomy, right? So there's another reason that why we need to learn yoga anatomy especially. And in slowly in my lecture you will understand that anatomy, and trust me, you're gonna love anatomy, because most of the time when I talk about the anatomy, that it's great, anatomy means lots of technical terms, but no, you're gonna find that it's very easy to apply on the mat, even off the mat as well. So the first concept I would like to add here as a part of applied anatomy is the moment we are doing asanas, like forward bend, backward bend, any kind of posture, lots of commands we get, that doesn't work. Just for example, and you can also do the practice with me so that you can feel these things much more easy. So just for example, we give lots of command, like we say roll shoulder back, right? This is one of the very basic command. We say roll shoulder back. We say take a deep inhale. So in the beginning we say, okay, take a deep inhale. But these commands, does it work? Because actually we don't know what happened when we take a deep inhale. We don't know what exactly happened when we roll the shoulder back. So just for example, you are doing asana such as twisting pose, right? And you get a command that roll the shoulder back. So can you just all roll the shoulder back like this? Okay, so the moment you roll the shoulder back, and now try to rotate your spine. Roll shoulder back and rotate your spine. Can you feel this little hard? The range is limited, but now roll shoulder a little bit in, little bit, and now rotate your spine. Can you find this a little bit more? Right? So that's for the understanding of anatomy. So use the joint in the right way, in the right direction. Another example, how many of you struggle in the cow face? In a cow face, this is we call it a cow face, right? It's hard to grab. For me it was very hard to grab, especially for the beginner, those who have a tight shoulder, it's very hard to grab. But if you have a knowledge that how I'm going to use that joint, especially the shoulder joint, I can easily grab my finger, my flanges. So for this, what I'm going to do, These are quick tricks with the help of anatomy. It's not just like one day we are making our muscle extremely flexible. No. So for example, if it's hard for me, I can push this shoulder down. This is my left side, this is my right side. So I'm pushing this right shoulder down. This arm becomes a little bit longer. So when this arm becomes a little bit longer, it can cover more space and it's gonna be much more easy for me to grab my finger. So just by pressing one shoulder down like this, I'm not saying bend the spine, but just the one shoulder down, it helps you to improve your flexibility. And this is not a miracle things. This is we all are well flexible from the joint. But just we need to use the right way to use the joint when we do asanas. Is that part is clear? Right? So this is the whole concept of the anatomy. Use the right actions from right movement from the joint. Now, let I complete a few things here because we are going to understand anatomy. So definitely we need a little bit understanding of anatomy. So first, here I am going to mention the two terms, action. Second is movement. Because sometimes we get confused. So action and the movement. So action which comes from muscle. So if I talk about the biceps action, triceps action, because this is the muscular movement. Second movement is from the joint. So elbow movement, knee movement, hip movement. So for the joints we use movement and for the muscle we use actions. So action and the movement. Right? So when I say hamstring movement is not a right term. Hamstring actions. Because hamstring is a muscle. Second, knee movement is not a knee action but it's a knee movement because I'm bending and moving the joint. Is that clear? So action and the movement. Now the very basic part when we talk about the yoga anatomy is to understand very interesting part and the very important part of the yoga anatomy is our spine. And this is, I think, everybody, every teacher, every yoga practitioner, even everybody should know about the spine. It's okay if you don't know about the knee, it's okay if you don't know about the ankle, lots of things. But at least basic anatomy, everybody must have to know about the spine because nowadays our spine is struggling with us, right? With our weak posture, the spine is struggling. If we are sitting, our spine is struggling. If we are eating a lot, the spine is struggling. Even we are thinking a lot, the spine is struggling. Stress, anxiety, worries, the spine is struggling here. Is that clear? So we are going to talk about the spine. This is very, very important and everybody should know about this thing. But now, before I jump into the anatomy, first I would like to tell you a few things here. Whatever we think in our mind, it manifests in the physical level. So means our thought, our emotion will affect our body in the many different ways. So when we talk about the asanas, it's related to the spine, it can be any posture. So lots of time you might have think that why I'm not able to do back bend, why I'm not able to do forward bend, why I'm not able to do rotation, why I'm not able to do twist or different bending postures. Is it any problem in the spine? But before we blame to the spine that because my spine is tight and my spine is not working properly, my movements are not there, my range of motion is less. First I would like to tell you to understand restrictions. What mainly stop you? Right? So there are so many things can stop in order to do asanas. Lifestyle is depend what kind of posture we are doing. But here I would like to mention 4 main restrictions. As my understanding, right? It can be more than 4, but just 4 main restrictions I would like to add here. The first one is bones. So for example, we have different orientation of the bones, right? We have different structure from the bones, and we all have a different structure. We don't have same structure, right? So first is the bone. So if I'm doing back bend or forward bend, especially from the spine, and I found my lumbar bones doesn't have enough space. I will discuss a little bit later that where this space comes from. So if there is no enough space, what does happen? We will feel block. And when the two bones come closer, this we call compression. So the two bones are coming closer, this state we call compressive state. And this state can give a loss of injuries if you keep forcing two bones closer and moving with a force. Second restriction is our muscle. So this is, we all know that, okay, if I can't do forward bend, back bend, it's not just a spine, it can be the muscles are overactive or tight, right? So tight or imbalance with the muscles can also affect our asanas. But what's the solution for bones and muscles? So because we can't change our bones, so we can change the angle of the posture, we can change the alignment of the posture, because we can't make our bones flexible, and we should not try even. So if you found that, okay, this is my structure, we have to happily accept it. Right? There's no problem, because we all are individual. We all have a different anatomy. But if the muscles are tight or weak, we can work here. We can make our muscles strong, we can make them flexible. It's not an overnight game, but just like slowly, 1 and 2, 3, 4 months, it's gonna be well flexible. What is next? So 4 restriction I was talking about. So first is the bones, second is the muscle. Is that clear? So bones and muscle, right? Bones, we don't have lots of option, but yes, muscle we have many options. We can stretch in a different way. We can start practice, and I'm not saying gonna force your body, especially the muscles. Third restriction here is our emotions. And this is the biggest barrier. This is one of the biggest barriers nowadays. I'm talking about the modern society, modern way of thinking. So this is one of the biggest barrier, because whatever, as I mentioned before, whatever we think, it manifests in the physical level. So when you get angry, you feel tightness in this muscle. It's called traps muscle. When you get in fear, you get some sensation in the abdominal, the glutes muscle, thigh muscle, right? So you might feel sometimes these things, and it's very common. That's why this is also the psychological lines we mentioned, that if you can't do back bend, well, lots of people, they cannot do backward bend. It can be there is some injuries, muscular tightness, but also this could be there loss of stagnant emotions, suppressed emotions. So when we suppress so many things in the body, it also affects our muscles. And that's why loss of muscles in the human body, we call them emotion bag. Emotion bag means whatever we think, negative, positive, it's suppressed there. And this muscle become imbalanced. Right? Is that clear? So emotion can also, so if you cannot do back bend, it's not only the muscles and the bones and I'm a beginner, I'm an advanced. It can be the emotions. And that's why I have seen most of the time when the practitioner, they do back bend, naturally they get tears. And it's very normal, there's no judgment, but it's very natural because they release their emotions. And after when they release the emotions, they feel very calm, they feel their muscles are like very loose. Right? So when you're doing asana, if you get such kind of the emotion, please just don't suppress, just let it go. This will help you to improve your flexibility. Right? What is the next? And also there are so many things connected to the emotion, which I discuss also with my further lecture, connected to the joint as well. If you might have seen lots of people, they have a rolled shoulder, they are like this. Right? It's a very common problem nowadays. So shoulder problem, rolled shoulder problem is also connected with the spine, yes, mid back. So what are the basic reasons the people they have rolled shoulder? It could be computer. Right, they are working 12 hours, 15 hours, 20 hours in front of the computer. But it can be insecurities. Because most of us, we have now different kind of insecurities, social, financial, relationship, there's so many things are there. So our body naturally, the defensive pose is this. Maybe from like outside I'm like this, I'm relaxing, but from inside I'm like this. And that's why the people, they have more rolled shoulder. So that's why in order to improve the flexibility, in order to improve the asanas, we also have to work off the mat. And that's what we also learn in anatomy. So for example, and that's why I strongly recommend to the practitioner that, did you feel sometime that day when you are very happy, your hamstrings are also very happy? You can stretch them, more, you can go a little bit further. But the day when you're a little bit sad or some emotional imbalance, you're just like stubborn. You feel like, oh, yesterday my hamstrings were very flexible, but what happened today? So that's why the most of people, they get injuries when they are emotionally not stable. So the moment when you feel a little bit not stable, and that time you can just not force your body, but the day when you are happy, this is your day, you can a little bit extra stretch. And I'm not saying to force for the stretch, but a little bit. What's the fourth restriction? Is a fear. And this is called mental fear. You might have seen sometime when you do back bend. You always want to see the floor, like when you do drop back. You like this. And this is very, very normal. Actually, we should not make anything dogmatic. Oh, why you're feeling fear? It's very normal. The basic reason is our eyes are front. We don't have eyes from the back. So our brain wants to know what exactly happening. How much the distance? Is it safe or unsafe? And that's why when you do the back bend, headstand, or other balancing, or so a little bit dangerous postures, this is the basic instincts, and which is very, very normal, right? How you can improve this mental fear during asanas? It's just to keep practice. For example, if you have fear with this, come from the wall, right? Take a support from the wall and slowly give confidence to your body that I can do it. Because once you give a confidence to your body, you can easily achieve it. Same for the emotion, let it be. You don't need to stagnate. And this will, trust me, once you start that tools which you call let it be tools, you can see the tremendous changes in your flexibility. I have seen personally, right, when I go for the workshop and the different places for teaching, I have seen that after and some specific techniques, and even after doing meditation, even after doing when they express themselves, they feel tremendous changes in their flexibilities. They feel much more relaxed. Why? So these are the 4 basic restrictions. Is that clear? 4 restrictions, right? There can be ligaments, tendons, and cartilages. So many things are there, but these are among the many. These are the 4 main, right? Now, the next is, in order to understand spine here, because I would like to not just discuss about the basic skeletal system. I would like to discuss all the aspect of the joint and all the aspect of anatomy, because it's not just a learning bones, then you can understand everything, right? So I'm just trying to cover the different aspect here. So the spine, when I say, the first thing is, I'm not going to call spine as a column. You generally read, oh, we have a spinal column, right? The spine is not a column. Column means this one. You can't bend it. You can't bend column. But you can bend from segments. So instead of calling spine as a column, I'm going to call the spine as a segment. Because I can bend my neck separately, I can bend my mid back separately, I can bend my lower back separately. But you can't bend a column separately. You have to just bend it whole. Is that clear? So spine I'm going to call as a segment. Now the next point here is, so let's just start a little bit basic anatomy of the spine. And it's very easy. And once you know the anatomy of the spine, you are not going to torture your spine. I'm sure. So the first is, how many bones do we have in the spine? So I'm not going to make it a little more confused. I'm just straightforward going to say 26 bones we have in the spine. You might read in the Google and other books, they say 33 bones. So the adult is 26 and children, they have 33. Because the children, their bones are not fused. So that's why their counting is different. But we are talking about adults, so most of the bones are completely fused. So we have around 26 bones in the spine. Is that clear? Now we have 3 main segments in the spine. 3 main segments, that's what we need to understand. It's very important. First segment we call cervical. And in this segment we have 7 bones. So first segment is a cervical. In this segment we have 7 bones. Second segment is thoracic. In this segment we have 12 bones. And all these 3 parts have a different functions, okay? So we also need to understand their functions and their movement. Number 3, we have lumbar, which is your lower back. Here we have 5 bones. First, mainly we understand these 3 main segments, and rest of 2 segment, because these rest of 2 part are not well flexible, sacrum and tailbone. So which we'll discuss a little bit later. First, I would like to give a little more light on cervical, thoracic, and lumbar. The best way to remember cervical, thoracic, and lumbar is 7 a.m. breakfast, 12 lunch, 5 dinner. So you can easily understand in this way how many bones do we have, right? So 7 a.m. breakfast, cervical, 12 lunch, thoracic, and 5 dinner. So 7, 12, 5, right? So you can easily understand. These are just some quick tips for anatomy to understand. So cervical, so let I have the help of this. So it is real, okay? Right, so his name is Jackie, and he's also going to help us to understand, what actually we look from inside. So you can see a little bit more closer that how we look from inside. Right, so when I see the spine, so you can see we have a spine, right? Now, you can also say hi to him. He will reply, might be. So this part is a cervical. So here we have 7 bones, right? So this part is the neck part, simple, just make it more easy. This is the neck part. Then we have mid-back, which you call thoracic, right? So this is the mid-back. And if you see the difference, mid-back has mainly connected with the ribs, right? You can see the mid-back is connected with the ribs. That's why this is a very important part. So mid-back connected with our ribs. That's why the chest is not only this, that we think only this is the chest. Chest also goes here. Because the ribs are here, it's not just front. Ribs also goes here. So that's why when you say open chest, basically from front you are opening, but from back you are closing. Is that clear? Because the chest is not just the front, it's the whole part from here to here is the thoracic or chest area, we can say. And this is we have lower back, which you call lumbar, right? And the rest of 2 other part we have, but I will discuss a little bit later with this. So cervical, thoracic, and lumbar. Now I want you to just feel and experience one thing, that can you see the back side of the bones here? Just see. Can you feel this is a different? There is a difference, right? Now see the bones from front. Different. So from back side, you can see now from in this angle. So from back side, the bones are different. It's like more about notch. From front, the bones are different. And why we have different? Because they both have a different job. And now you will understand why do you feel pain when you do back bend. So see, these bones are designed for stability, right? But these bones are not designed for hold our body weight. So when you do back bend, you do this. So where is the most of the weight? On these bones. But these are not designed for hold our body weight. That's why you feel discomfort, that's why you feel pain. That's why you feel injuries, right? But if you see from the front, these bones, which is a part of the spine, I'm not saying they are a separate bone, but their structure from back and the structure from front are different, right? So if you see from front, these bones are designed for hold our body weight. That's why our standing samasthiti is very, very important. Is it clear? Right? Because in samasthiti, you also learn where should be my most of the body weight. It should be like this, or it's in balance. Right? Now let's check how many movements we can perform with the help of the cervical from the neck. Right? So from the neck, what we can do? We can do this. We can do this. Can you show me that how many movements you can perform from neck? Possible movement, or not force, but just yes. We can do this. We can rotation. Different movements. Right? I will little bit discuss more about the movement later on. So